Hey guys, we are back for this week's edition of Docs Talks, and we have a special guest, Dr. Kelsey Booth. It's my wife. So we're going to be talking about training and having an autoimmune issue, and what kind of procedures we would look at for maybe diagnosing that, looking at other symptoms, all that kind of stuff. So that's what she does. I'll let her introduce kind of her specialty.
Okay, I'm the other Dr. Booth. So exciting. I work at Red River Health and Wellness. We're just down over on Pecos and Pebble area, kind of right off the 215. That's where the clinic is located. And Red River is sort of a Western regional company, so we have multiple clinics, but I run the Vegas clinic here. So, it's great. We work with a lot of people that have autoimmune issues. I would say the patient base that I see typically has issues like chronic fatigue. We see a lot of GI issues, again, autoimmune diseases. It's kind of across the board. We're almost kind of like, we're not primary care, but we sort of almost are because we're dealing with so many of these issues. But really educating, like first and foremost, educating people about their condition and then helping them find sustainable solutions to manage them. So that's what we do. And that, of course, that involves training. I had somebody literally come up, I think I told you about this. Somebody came up to me and it was a patient and said, "Oh, I thought that you were not supposed to train with autoimmune diseases at all, like not weight lift specifically." And I was like, "Who told you that?" So it made me a little angry, in fact. But
that's the reason for these types of conversations, so that you guys can understand a little bit more about whatever symptom is that you have, whatever syndromes that you have, pains, dysfunctions, so we can get a little bit more clarity on some of that stuff. And Kelsey's worked with a lot of people, and she's implemented working out and training in those fashions and those types of people, and it's been successful because it helps everything else. Just like what we've talked about in the past, Zach and I have had multiple conversations, and you guys have seen them, where we're looking at the entirety of the body, not just working out, not just getting treated by Zach or I. We try to look at everything: sleep, food, nutrition, all that stuff. And that's a very similar approach to what she does with her autoimmune patients, but just a different spectrum. Looking at the topics that we're going to go through, we're just going to have a brief overlay of what is an autoimmune disease, and what are some common things that have been diagnosed, and what should we look for those. So common autoimmune diseases that you work with.
Yeah, well, we can start by talking about what they are, and then we can talk about commons. But so with your immune system is really there to protect you against things like the coronavirus. It's a sensitive topic, I know. But, right, viruses, bacteria, things that are... I know, stop. The things that are a threat to your system, right? And so that's what your immune system is there to do, is to fight those things off. So to do that, it has to stimulate some sense of some sort of inflammation, right? Some sort of an inflammatory response. And in a lot of cases, inflammation is a lot of times pegged as a bad thing. You guys, I'm sure, would agree. But there's a lot of situations where inflammation is really good, right? If you get a virus, you need a fever to break that virus. If you bust an ankle, right, training with him, then you need but you need your ankle to swell, right? Like, you need that to happen. So the thing is about inflammation is it should be transient. It shouldn't be there all the time and in high amounts. So where autoimmune diseases come in is if you are chronically exposed to something that's inflaming your system. And again, that's why these guys too work on addressing so many different facets of lifestyle, is because so much of it can cause inflammation in different ways. And so if that's not controlled, your immune system over time can get really confused, and it will start really initiating an attack on your own body tissues. And that's when we call it a self-attack or an autoimmune disease. The couple crummy things about it is that if we do have an autoimmune disease and it's been identified, it's not a curable situation. So it's sort of like a switch that gets turned on. Once it's on, and once we have antibodies present, right, they're not, they're probably not going anywhere, right? They're typically lifelong conditions, and we don't really have a cure for them at this point in our medical world. So there's that to be considered. The other thing is that literally any tissue in the body can be subject to an attack by your immune system. So you've probably heard of tons of autoimmune diseases without even knowing that they're autoimmune diseases, things like rheumatoid arthritis, things like lupus, Sjogren's, things like multiple sclerosis, Hashimoto's. Those are a lot of the things that we see. Hashimoto's, which is a thyroid-related autoimmunity, is actually the #1 most common in the United States. So we see a ton of thyroid cases. But it's very, very abnormal that we don't see other autoimmune diseases with that. So we'll usually see, like, I know I've told you this a million times, but we'll see Hashimoto's cases, and then usually I'll go looking for other signs of autoimmunity because they're almost always there. Pernicious anemia is one that is super, super abundant that gets missed a lot. So a lot of those conditions, even things like celiac, ulcerative colitis, I mean, these are autoimmune issues. So, so there you go.
So when do you start to suspect autoimmune disease in someone? Like, what are some of the signs, or like if someone starts saying these types of things, I might need to go down this route? Yeah,
that's a good question. And it can be hard because everyone's different. I mean, I'll see one person with Hashimoto's and the next person will they'll present totally different. But there are definitely a cluster of symptoms that I would say are common along with those conditions. So things like, I mean, just like what you guys have talked about, chronic fatigue is a big one. When it comes to training, I would say problems with recovery. Like if you had a good workout that wasn't anything that was really outside of your comfort zone, but you felt like you got hit by a train like for a week after, that's probably a sign that there's something going on internally with your system and we need to take a closer look. So things like that are big. Other signs are things like other hormone imbalance signs, so like insomnias, again, problems with sleep and lifestyle in those regards. Having like sensitivity issues, so either chemical sensitivities, like, oh man, you walk into a tire shop or a mall and the perfume scent is just like really overwhelming. That's actually a good sign that we're having a breakdown of the barrier systems in the body, and that can also be a sign that your immune system is reacting inappropriately to your environment. So those are some signs too. I would say those are the main ones. Yeah. That I see in here about a lot. And then again, the GI stuff. GI stuff is common, right? I would say diet is definitely something we work a lot with, and I know we'll probably get into it later, but it's honestly probably a minimal part of how we help manage a lot of these conditions. But there's definitely a lot of people that deal with things like food reactions, right? Food protein sensitivities versus allergies, right? A little bit different. So
yeah. There was a phrase, I think, maybe this was David Butler. He's a big pain researcher, but he talked about the immune system. He says the immune system basically acts when you are not you. So, Kelsey, would it be fair to say, like, if you are not responding to things as you normally would, then it could potentially be an autoimmune component at play.
Totally.
So then what are the next steps for someone to get that checked out? Because I know there's a lot of people out there who have this kind of stuff, and they don't think to look at this as being a factor.
Yeah. Well, and one thing I'll point out too is family history is always important to look at, because people who have autoimmune diseases, generally we have some sort of genetic predisposition to these types of conditions. So looking at that too is also a big clue that, hey, if I'm starting to see some of these things, that's also a good time to get checked. What was your question? Sorry.
So like, what are the next steps? So someone is experiencing some of these things.
Yeah, so next steps is obviously evaluation, right? I mean, a workup and evaluation, which we do a lot of. We do a pretty hefty eval for our patients, so I guess I can kind of talk about that as maybe to give people an idea of what the workup is. And again, it's going to be different for everyone, but generally when I have someone come in with a lot of these complaints, I see a lot of people who have gone from like primary care to rheumatologist to endocrinologist to cardiologist and have had like tons of testing and no answers. So usually we get like an inch thick paperwork and
that's what she takes home with her too, by the way.
Yeah, I love going through all that. But those are the typical people I see, and really honestly we can start with some pretty basic tests and looking at immune system function and whatnot, and measure things like, how are the organs functioning? How is the blood sugar stabilizing? What are the inflammatory levels? Like, these are all things that can be done pretty generally and then in a basic blood test. But then also looking at other things. We look at really simple vitals, looking at things like blood pressure, pulse oxygenation readings, neurological testing, right? Because a lot of people that deal with autoimmunity, sometimes their neurological system can be impacted. So doing an in-person exam as well as blood tests, I mean, that's really the first step in working somebody like that up. So that's where we'd start.
You mentioned that, this kind of goes back to what you were saying in the beginning. You have a patient that comes in, they have a confirmed autoimmune disorder, they flips a switch. And you said there's typically not a cure for them. So in your case, you manage them and you try to educate them on how to manage themselves lifestyle-wise, long term. Is that correct?
Yeah, totally. And I get a lot of questions too on that, like, well, how come, I was fine and then all of a sudden it was just like this, either this thing happened or this point in my life came and all of a sudden things just went downhill. And I hear that happen all the time, and especially with a lot of the research, like on auto, and this isn't really addressing your question, but as far as like when this stuff happens too, the biggest triggers, especially for females, like females are more predisposed to autoimmune diseases because they're more subject to inflammatory events. They deliver and bear children, which is very inflammatory for the human body. They also have more complex hormonal cycles, and so that also predisposes them to inflammation. So there's other things too, but those are some of the main reasons. But childbirth is actually one of the main triggers for females developing Hashimoto's. So there's different things like that where you can have an event and then all of a sudden that switch will flip, and then all of a sudden we've got all these issues, right? So the goal is identifying it, and then again managing and trying to see, okay, how can we optimize lifestyle and whatnot, and all these different facets to really dampen the autoimmune expression, because that's really what we have to do at that point. So.
And there's an emotional tie to that though too, right? Like it's not just the inflammatory response, but sometimes it could be just the emotional tie to that.
Oh yeah.
And maybe that obviously triggers some of the hormone release.
Oh
and
yeah,
all that kind of
it's
stuff
all
too,
important.
so.
When you have an autoimmune disease, everything is important. Sleep is important. Training is important. Diet is important. Stress responses are so important, and a lot of people don't realize. I've literally sat, and again, I mean, you've heard this, I've sat people down in my office because they want to move forward with care or whatnot, and they have a crazy autoimmune disease, and they've got this just like crazy stressful life or job or whatever it is, and they're not sleeping and all this stuff. There's nothing I'm going to be able to do for them, until they get that stuff figured out. And having that kind of a real conversation is something that happens a lot in my office with the kinds of conditions that we see, because it's so truly impacts the course of people's health with this stuff.
How can they not hurt themselves?
Yeah.
Continue to hurt themselves.
Yeah. It's huge. It's huge.
Cool. So talking about triggers and stress, that was one of the ones that we wanted to talk about, but you kind of hit on some of the events as being triggers. Anything else trigger-wise that's pretty common for these types of patients? Yeah,
I mean, I will say, as far as what to expect from autoimmune diseases, they typically they're relapsing and remitting in nature, so meaning they roller coaster, right? So there'll be normal points, and then some people will go into low slumps, and then other people will have great times, right? And then they'll be totally fine for months at a time, and then all of a sudden they'll be sort of back in a slump. And so we actually use the term remission a lot with autoimmune issues, because you can sort of, if you, and again, some of it's out of control, but as much as we can, we want to try to put these conditions into somewhat of a remission so that they stay, again, dampened and minimize the severity of flare-ups when they do happen, whether that's joint pain, whether it's skin issues, whether it's GI problems, whatever the presentation is. So,
and I would say with the stuff that Zach and I work on, if we're looking at more of the biomechanics and pain, we would have the same type of approach. How can we minimize the risk for someone to have a back pain episode? There's always going to be, you could treat someone exactly perfect, you know exactly how they move, and they could have a bout of back pain. We're just trying to minimize the risk, though. I would say that's probably a goal for most of our treatments.
For sure. We
can't ever speak in finality, like, oh, you're never going to have back pain again because you just got the best treatment of all time.
Yeah. Well, you hope not, because the immune system is not a bad thing.
Yeah.
Pain is not a bad thing. Pain is there to protect you, and you want pain if you got cancer, right? And you want it as quickly as humanly possible so you can get treated. And same thing with the immune system. You want a highly functioning immune system, especially now because of coronavirus. So it's when these systems go awry that we have to do, like you said, get things into remission and then build your resiliency so you stay in those periods for longer.
Exactly.
Or if you fall into a time when you have a flare-up of symptoms, that you're not in it for as long of a period of time.
It's so true. And that's why, too, like, you're not, I think people's expectation is, oh, well, I just need to get rid of all the stress in my life, or I just need to, stop doing my really rigorous job. It's like, you're not going to get rid of this stuff. Like, we're all going to have stress. We're all going to have physical demands at work, whatever it is. But if you can really build, that's why the training stuff is so important, because if you just sit around, especially having the mentality, oh, I need to really protect myself, I can't train, whatever that is, you're never going to build up the resiliency to be like more bulletproof to life, you know? Like you have to kind of train your body in a lot of different ways to manage the stress that's just inevitably going to happen. And and it takes a lot of effort to do that. I mean, it really does, and really a lot of consistency to do that, but it's so important. It's crazy.
Yeah, so we can talk a little bit more about that topic, because it's the next topic we wanted to bring up is exercising and training with these types of conditions. I know you spoke about some of the slow progressions that you've had with patients. Really, really slow progressions just to kind of jumpstart and kickstart the body. Can you go into a little bit more maybe specificity on some of those?
I can.
Thank you.
I sure can. So exercise too with the autoimmune population can be tricky, because I mean, you guys know exercise will create to some degree oxidative stress on the body, you know, like overtraining is a super real thing. So if we have somebody who, again, that's like the person that walks into the perfume store and they just like get an instant headache with all the perfume, their barrier systems are broken down, right? They're too reactive to their environment. So a lot of times with those people, if they're really in kind of that state, if we go and have them train for an hour and weight lift, they're going to, again, be hit by a train for the next week, right? That's how they're going to feel. So as far as grading, there's some things that I'll typically do. If somebody's inflammatory levels are really high or they're in an active flare-up, whatever the situation is, the first goal is calming their system down before we really do any serious or rigorous training, right? And then when we do grade into it, it's really small, and honestly, there's no like formula for it. That's why working with a coach is like totally invaluable, because if it's kind of a trial and error with exercise. You kind of want to find that perfect balance as far as what's enough to really stress and push the body, but not so much where we're taking one step forward and 2 steps back with training. And so that's huge with, and again, working with people who know how to monitor that and gauge that is like essential in a lot of cases. It depends on the person too and their comfort, and you guys deal with that a lot too, and work with some people who are not familiar with training and others that are really comfortable in the gym and whatnot and with their limits, but that can change too with autoimmunity. So that's definitely a big one.
Yeah, what we've had success with here is, typically most of our clients will be in here for an hour, but if you're someone with an autoimmune disease and you have a low training age, we usually cut that in half to 30, 20 minutes, and then a lot of our activities will be on the lower intensity side of things. And then, like you said, give them a little bit, see how they respond, and then we can make adjustments accordingly.
Love it.
Yeah,
awesome.
Build that stuff up. And having it custom to that person. You don't just follow whatever it says on the sheet that day. You listen to the person. You listen to what you're trying to accomplish. You're trying to align those goals. Custom training is something that needs to happen for that type of a patient or that type of a client, because there's some days that, like she said, there's roller coasters and there's going to be bad days and good days. If we can still get a little bit of movement in that day, but we don't have to follow exactly what it says on that sheet, because the coach says, look, I know you're having some issues, you're having some problems, let's do this instead. Having a coach that has that type of mentality, that wants to take care of you first instead of just following the sheet, key, very, very key for that stuff.
It's like diets. Like there's so many diets out there and like different fat, and they're all good. It just depends on what's good for your system, right? And that can look like a ton of different, situations for the exact same diagnosis. So, it's the same with training.
So I'm a big fan of the ice cream diet.
Yeah, the ice cream diet. It's the best one.
Yes.
Have you heard of the crumble diet?
The crumble diet? No, what's the crumble diet?
Kyle knows why don't you tell us what the crumble diet is?
Well, the crumble diet is at 9-ish o'clock, you go to Crumble and you get some cookies.
Oh.
And you crush them.
I've never been
on the way home.
I got to write this down.
But
we should
crumble
not be
cookies,
talking about this right now.
Yeah, that doesn't lead to anything good other than very tasty cookies at night.
Leads to an autoimmune flare-up is what it leads to.
Probably that too.
Crumble.
Yeah.
Crumble, yeah.
It's on my list of Vegas restaurants right now.
It's very good.
Just put it there.
It's a franchise, so.
Oh, okay.
Yes.
Okay,
I was going to talk to you, so we have to at some point talk about like high intensity interval training, because I don't know how, I'm sure you guys do, I'm sure a lot of that built into programming and stuff, but I'll use a lot of that with my patients too. And one, because you can do tons of different forms of high intensity interval training. It's probably one of the best studied forms of exercise too, especially on its effects of dampening inflammation. So we'll use it a lot for our autoimmune patients because it can really, and without overtraining too, you can do really small bouts, anywhere from, sometimes when I start people, we won't start beyond 3 minutes of exercise, like in a day. And we'll go grade it up to sometimes like 5 to 10. It just depends on the person and what we're doing. But high intensity interval training is awesome. And you can do it with really minimal equipment, especially with the pandemic going on. People can do this stuff in their homes, in their bedroom with, 5 square feet of space, and they can get it done. So I will use high intensity interval type strategies for a lot of people I work with, and it's really successful. So
Now, when you're saying high intensity, you're not talking like 30 seconds of burpees and
no,
snatch, especially if someone's going to
Yeah.
be doing only 3 minutes of things. So
exactly.
it's important that high intensity is relative to that person.
Totally.
And that could be just walking around the house for
High stuff,
30
yeah,
seconds.
like
100%.
And that's your high intensity, and your low
Yeah.
is just sitting and chilling
It's
like Bob Dylan.
Totally person dependent.
what are some examples of that? I mean, just give me like, has it been air squats? Has it
Yeah, I
been-
mean, it could be literally getting up and down from a chair, right? Depending on the age and the fitness of the person I'm working with. It could be it could literally be walking, right? At a steady pace. And then maybe for their high intensity, they walk a little faster, right? I mean, we might start there, and that's perfect for some people. For others, it might be something a little bit more high impact. So it could be things like, faster squatting without a chair, without assistance. It could be jump roping. It could be jumping jacks. So, I mean, it's just the options are endless, but it totally depends on the person. So.
Yeah, and especially like the presentation, right? If they're
Yeah.
having a ton of joint pain, then we don't want to have a lot
Totally.
of impact, and we're not going to
Yeah.
sit there and put them in jump rope situations probably. But, when we were talking about some options, if there was like a low impact option, carrying, rucking. We've talked about rucking in some past videos. Very, very good for putting stress on the body but not having a lot of shear forces on joints. It can be very, very powerful for getting muscles to contract at a little bit higher than just your body weight, and still getting the cardiovascular effects and all that stuff too. So rucking, carrying weights, those are going to be probably really good options for low impact, low stress on joints if you have anything that's going on at an autoimmune level.
And if there's oxygen problems, right? If someone has I have a lot of people that have anemias, and so if we just throw them right into exercise and something that demands a lot of their oxygenation system, they're gonna struggle really bad, and it's gonna set them back. So I mean, all this stuff is really good, but we have to make sure that people are actually in a place where it's safe to even start low levels of activity, and that's where too the different forms of exercise. You can do some things where you put your body under load and stress, but it's not really cardiovascularly, it's a hard word to say, but challenging, right? Yeah, I know, it's really long. So, it depends. There's definitely, it's condition dependent, person dependent, but there's so many things you can do, which again is why working with a coach is awesome. So.
Cool. So last topics, some things to consider on how to start turning the dial down on some of this stuff. We've talked about diet. We've talked about some food stuff. Let's see if we can expand a little bit on common interventions for these types of people in terms of diet, and maybe you'll probably talk about sleep a little bit.
Yeah, I was gonna
too.
say yes.
But let's start first with just food choices in general.
Yeah, I mean, again, it's hard to give any specific recommendations. There's so many good diets out there. There's all the crazy ones. There's anti-inflammatory paleo diets, there's carnivore diets, there's veganism. I mean, there's all sorts of stuff. There's keto. And I honestly have used forms of a lot of these with a lot of my patients. It just depends on the person and the effect that I'm trying to get as quickly as possible with them, right?
And the testing on the front end.
And
right?
the testing on the front end, it really depends. So it's really hard for me to say. And anything too, you guys are watching and reading blogs and stuff all the time. If you see stuff like, oh, this food list is bad for thyroid, please run in the other direction, because that stuff is so misleading and it's just not true at all. And things, even foods that are typically inflammatory, I would say probably among the top 5 really inflammatory foods that we will a lot of times tend to take away are things like gluten, dairy, corn, soy, and eggs. But honestly, those foods a lot of times will get demonized, and they're not they're not always really a big time trigger or a big time problem with people with autoimmunity. So yes, they can be important precautions to take as far as avoiding them, and that's again a really, really generalized recommendation. But just some of the things we see in research too that will typically be associated with a lot of autoimmune conditions and whatnot. But I've also worked with a lot of autoimmune people who get to the point where they're really functional and whatnot, and they can eat these foods fine occasionally, right? So there has to be balance, there has to be sustainability in the long-term plan, but just the whole fad diet thing is just, it's really a problem. So it needs to be very personalized and customized. So
Cool. Do you want to touch on?
We should talk about sleep.
yeah, let's talk about sleep,
Yeah,
because
let's talk
that
about
is something
sleep.
so many people I have to deal with problems with.
Yeah,
So it's
well,
bad.
If you want to talk about inflammation,
Yeah.
not sleeping is one of the best ways to induce inflammation into your body.
100%.
With weight gain too. Right?
With weight gain
Oh, yeah.
too, and you know, you talked about managing blood sugar and things like that. Well, if you have a couple nights of poor sleep, you will be pre-diabetic
Yeah.
for a short period of time. So it's incredibly important that you sleep. Some of the big things that I like to work on with my people, if I don't always go like sleep more hours, because as we talked about very early on, well, there's a lot of stressors in life you can't change. You can't
Yeah.
quit your job, you can't sell your kids, you can't do all of these things that are causing stress in your life. So a lot of times making sure that the quality of sleep is on point is incredibly important. We talked a lot about that last week, but making sure your sleep environment's cool, not like cool, but cool temperature, making sure that it's not bright like it is here. You got blackout curtains, all that stuff. You don't have Zeke in the bed with you.
He's the worst at that.
Yeah.
I always try to get the dog to sleep in the crate, but
Lies.
Softy over here.
Oh man,
Complete lies.
Man, yeah. So, but basically, you don't want things to induce allergens, so you can breathe effectively. Making sure that you're getting sun exposure in the morning, making sure that you're minimizing bright lights at night. All of that is extremely useful. And if you can't sleep more hours, trying to get up at the same time and going to
Yes.
bed at the same time is also very
Thank
useful.
you.
Because that creates a rhythm.
It's huge.
And that does a lot of profound things from a hormonal standpoint,
It's huge.
among other things. So a lot of times just making those small adjustments before extending your sleep can help you get the most out of it.
And I have a question for you on that specifically too, because I'll have a lot of people, especially going with like high intensity interval style training, things like that, some exercise strategies I'll have people do. So blood sugar is a huge issue with sleep that I like, hypoglycemia episodes, poor blood sugar stabilization, just going into sleep, people can't maintain a good night of sleep. So there's that. But if we can get that managed, a lot of times too, I'll see good results of having people exercise first thing in the morning as a way of also resetting and kind of stabilizing their sleep cycles and circadian rhythms. So what's your thought on that? Do you do that with people? Do you recommend that?
Yeah, if you're going to do it, that's one of the better times to do high intensity, because the two big hormones that we're trying to manipulate with sleep and wake is cortisol, which should be higher in the morning. You can increase cortisol production with more intense exercise. And then melatonin at night. So if you're going to go hard, it's better to do that in the morning generally, or at least earlier in the day. It depends on your adaptation. If we're talking about just hormonal benefits, that's when I would do it.
Yeah.
But if you're doing something like aerobic exercise or something that's not as intense, it's actually better to do it later on in the day. And generally, your body temperature is the highest between 5 to 7 p.m. if you're going to bed at or if you're waking up at say 7 to 8 a.m. And an important thing with falling asleep is having this maximization of temperature at that time period, but then also the dip at the end of the night, because when you go to sleep, your temperature should drop, and that prepares you for sleep. So either of those two time periods during the day are very useful.
Yeah, that's awesome.
Exercise.
And that's too, like, even if even if people have a regular, maybe lower intensity training session scheduled later in the day, I will oftentimes still have people do like a 3 to 5 minute, again, if it's prescribed and if it's appropriate for them, like session in the morning where it's high intensity, and it's like their cup of coffee. Like they don't need anything, they get up and go, and all of a sudden they wonder why they're waking up before their alarm clock and they're perfectly alert. It's pretty awesome how effective it can really be with cortisol levels and things like that. It's pretty cool.
Yeah,
So
rhythms, that's good.
And it
That's
could be
awesome.
just as simple as banging out 5 push-ups and
like it doesn't-
doing some squat jumps and
not
things like that.
nothing magic. I mean, it's pretty amazing. So, and well researched, which is really cool. So,
Cool. Did you see any questions on the? If you guys had any
You
questions.
can't see that from here? Come on.
Nothing.
No questions.
That
But
means we're doing a good job, guys.
we're hopefully filling in all the blanks for you guys. But thank you for coming on and kind of giving us your knowledge, and
You are so welcome.
we appreciate your time. If you guys have any questions for Dr. Kelsey Booth,
Did you
I was
almost just
about to
forget
say-
my name?
Dr.
Well, no,
Booth.
I was gonna say Dr. Booth. Dr. Booth, but then I was like, oh, well, that's me. So if you have any questions for her, we will link her contact in the show notes.
It'll be in the show notes.
It'll
It'll
be
be
in the
on
show
our
notes.
blog, elevatespa.com/blog/autoimmune. Check it out. It'll be up there.
Nice.
It'll be on
Monday.
there. And if you guys have any questions about training with this, let us know, because we can hopefully get you into a situation where you're going to benefit.
And we do have a lot of people who have autoimmune diseases who train here, and we feel very comfortable helping anyone who has that. And if it's someone we don't have comfort with, we've got this person right here to help us.
She'll
so,
definitely help.
Good. We've got to work as a team.
yeah. All
Thanks,
right.
guys. We'll see you next week. Wednesday at 2. Do you know what it is? What's the topic?
I don't, so stay tuned.
Stay tuned for the topic. We have it wrote down, but we don't have it in our heads right now.
Yeah.
Thanks, guys.
Yep.
See ya.